Hello and welcome to Body Talk. My name is Kyle White. I'm a doctor of physical therapy. Today we're going to be talking about exercises to do before or after a knee replacement, especially after a knee replacement. I want to start by saying I'm not going to waste your time. We're going to get right into these exercises, but I will say the standing exercises in this video can be done maybe a week and a half out of surgery. You're going to be in a lot of pain those first couple of days, so take it easy. Don't get right into the standing exercises, but the rest of them you can start doing day one. And matter of fact, you need to do them day one. Like I said, I'm a physical therapist. I see knee replacements just about every single day. Like to say I have good results with them. It really depends on the patients, but overall, they've got the surgery down. It's really good surgery. And a lot of times people bounce back fairly quickly. Now this first exercise, we're gonna do it day one. I call this a knee extension mob with a quad set. And what that is, you're gonna be laying on your back. We're gonna have something propped under your ankle, air under your knee, so that gravity is helping us pull us into knee extension or to get that knee straight. And as you can see here, I'm contracting my quad. That's what we call a quad set. And that's gonna help us push that knee into extension. The quad is the major knee extender, and it's the main muscle we want to get back working after a knee replacement. That muscle has a lot of swelling. It's, in a sense, it has been turned off. It's lacking the motor control that it used to have before surgery. We got to get it moving. And by all means, we need to get our knee straight within those first couple of weeks of rehab. That is our main priority. Next, we're gonna continue to focus on knee extension, but we're gonna move into a standing knee extension exercise. Like I said, wait till about a week and a half out of surgery to do this exercise. We call this a terminal knee extension. It is a closed chain exercise. My foot is planted on the floor. I've got a ball. It can be anything. It can be a pillow, anything up against the wall that you can push the back of your knee into the wall and flatten the object out. We're just trying to drive our knee into extension. Great exercise for any post-op surgery, ACL, knee replacement, meniscus, anything. Great exercise there. Moving on, we're going to kind of move to a more seated position, and we're going to kind of get into a little knee flexion. This is going to be an active assist knee flexion exercise. Also with knee extension, for the purpose of this video, we're gonna say my left knee is my surgical knee. And so as you can see in the video, I'm using my right leg to push that knee into extension and also pull it back into flexion. The right leg is doing all the work. The left leg is just along for the ride. Keep that in mind. You're gonna have a lot of pain if you try to kick that knee up right after surgery. It's gonna hurt you. So make the right knee, make your non-surgical knee do the work. Right after that, we're gonna move right into another knee flexion exercise. For this one, you can be laying on your back. You may wanna have a solid bed or maybe even in the floor for this exercise. I like to tell people, put a pillowcase around your foot. It slides way better than a normal shoe or a good sock that you believe will slide well. You can combine two belts. If you're a woman, use your husband's belt. If you're a man, use your own belt. Anything you got in the house that can serve as an active assist, in other words, use your arms to bend your knee, is gonna work here. Like you can see in the video, I'm keeping my heel down. I'm trying to bend my knee as much as possible. Keep in mind that 120 degrees is the goal that we want to achieve with this exercise. You're not gonna get that week one, not even week two. But you will be surprised that if you do this every day at how quickly you will achieve that knee flexion. Next, we're gonna kind of get into a standing exercise. I like to get all my patients to do what we call heel to toe rocks. Not only is it working the muscles in our lower leg, AKA the dorsiflexors on the front of the leg, the plantar flexors or calf on the back of the leg, we're also getting a weight shift front to back, which is great. We got to learn where we are in space following this knee surgery. Our knee isn't going to have a clue what's going on. So we're getting weight bearing, we're getting used to putting weight through our heel and through our toe. And this is also going to help us achieve that heel to toe gait or walking. It's gonna help us normalize our gait pattern. Great exercise, working front to back there. Also, working off of the heel to toe rocks, we can also do a standing weight shift, lateral weight shift, where we just shift our weight from left to right. Like I said here in the video, we're gonna say my left knee is our surgical knee, and we're getting that left knee used to weight bearing. You're gonna be weight bearing as tolerated after surgery, unless your surgeon specifies otherwise. So that means you can put as much weight as you can bear through that side. And what weight bearing does, it activates the muscles in that lower extremity. It gets your nerves used to having weight on them, so therefore activating the muscles. You can also relax the leg. It has relaxing effects if you have a muscle spasm or overactive muscle that is tightening on you. This weight bearing is going to help with that. And it also helps with our balance. We're shifting our weight from one leg to the other, working on balance. That is my 6 best knee replacement exercises. I use these exercises with just about everybody that comes in the clinic, and eventually they all do well with these exercises. Now it is going to depend on your specific situation, how you respond and how quickly you get your motion and your muscle hypertrophy back. I like to tell people, 6 weeks or so, we should be looking close to our normal self. Don't get discouraged. It is a very painful surgery. Those first couple days are gonna be rough, but you got it. Stick with it. Do these exercises every day as much as possible. Some of these, the hill slides or the knee extension mode, I would encourage you to do those multiple times a day. Easy exercise that you can do anywhere. You're gonna really need that long term in your recovery, especially with that knee extension. Please do not sit around with your knee flexed on the couch with a pillow under it. That knee will stay flexed, and that's gonna affect your walking for the rest of your life. We need to get that knee extension early. And with that, that's gonna do it, guys. Like and subscribe to the video if you found yourself liking this video. We got a lot more content coming. There's probably some information on the page that you could also benefit from already. We'd love to have you.